Hi, everyone. Good afternoon and happy spring. I think a lot of folks are on spring break this week. So if you're on spring break and you're joining us, thank you for your commitment to health policy in Kentucky. And we know a lot of people probably have also registered for this and are going to wait for the recording to catch up whenever they get back in the office. But we're happy that you've joined us today. And I hope that everyone is having the kind of weather we are here in Louisville right now. For those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health. I'm a member of the ThriveKY campaign, and I'm here with my Thrive colleagues. I hope everyone here is recovering from what felt like, at least to me, the longest short legislative session ever. We'll be starting off today's webinar with a recap of the good, the bad, and the ugly from the legislative session. We've also got lots of other updates for you today, especially now that it's April and Medicaid renewals have officially resumed. So we're going to be covering all of that and more. And why don't we go ahead and share the screen, Alex? And we can go to the next slide. I know a lot of you tune in every month and you're familiar with the Thrive Kentucky campaign already, but for anyone who's new to these calls, Thrive Kentucky is a coalition, a campaign of organizations working to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting those basic needs. And you can see the principles that guide our work on this slide. And you'll have all of these to review later. So you'll be able to look through this more closely. We can go to the next slide, where you can see the different members of our campaign. And if you're interested in learning more about any of our organizations, you can click on those links. They're live. And why don't we go ahead to the next slide? Always want to thank our sponsors for supporting this work. Having sponsors allows us to provide these webinars for free every month, quarterly forums with the Cabinet for Health and Family Services, and a roadshow where we actually go in person around the state to visit different communities and provide lots of education and training. And it's something that we've all really enjoyed doing. And we also appreciate, how much people have started to rely on this information and attend every month. And it's really been just a great opportunity to have a network of advocates who are up to date on everything that's happening in Kentucky. And because we are providing this education, we're also able to provide CEUs for licensed social workers and for community health workers, and at times for others, especially if you do independent CEUs. So if you're interested in that and you want more information about CEUs, you can contact Kelly. If you want more information about sponsoring and helping us support those CEUs, you can also contact Kelly. Her email address is there on the screen. We are still accepting sponsors. The roadshow that I mentioned is going to be kicking off actually later this month. We can go to the next slide. And this is where our sponsorships really come in handy, because of course, going around the state takes a little bit more effort and takes some more resources. But we have really enjoyed it. Everyone was so receptive to the training and the information that we shared last year, and we wanted to do it again. So this year we're going to be visiting 8 different parts of Kentucky, 8 different regions. We scaled it back a little bit from last year for our own sanity, but once a month we'll be hitting the road, and our first stop is going to be in Bowling Green. So we'd love for you to join us there, or one of the other locations where we'll be this summer and fall. And there's a link at the bottom of the screen to register. Actually, I think all of those are live links. So we're going to be making this a little bit of an extended roadshow. Last year we did 2 hours and realized that wasn't enough time to cover everything we wanted to cover. This year we'll be doing 3 hours, but the real addition is having lunch and more time to talk and more time for questions. So we promise you that we will not be extending the actual content of what we're covering, just the time to discuss and ask questions and make sure that people can network and get to know one another. So take a look at that and share that with your networks. And then for today, yep, thank you, Alex. Today, this is what we're going to be covering. And we will be getting started with that legislative recap, like I mentioned. Before I hand it over to Dr. Schuster to tell us about what happened during the session, I just want to cover a little bit of housekeeping. We have a lot of folks on the webinar today, like always, so be sure to mute your line. We like to use the chat for comments and questions, and we don't want you to wait until the end of a section or until the end of the webinar. Just put your questions and comments in as you go, and we'll try to get to them as soon as we can. And we are recording this webinar, so you will be getting a link to the recording. You'll be getting the slide deck, and any other materials that we discussed today or share in the chat will be coming to you in a follow-up email. We try to get those out the next day, so that should be tomorrow. And then we'll also have an evaluation where we want to hear from you about what you liked, what you didn't, ideas for what you want us to cover in the future. And like I said, if you are a certified CHW or a licensed social worker and you'd like to receive CEUs, be sure to contact Kelly. So with that, I'm going to hand it over to Dr. Schuster to get us started.
Thank you very much, Emily, and good afternoon. I'm Sheila Schuster. I'm a licensed psychologist, and I head up the Advocacy Action Network, which is made up of the Kentucky Mental Health Coalition, 41 years old, 80 plus organizations advocating around health and welfare issues, and also the 874K Disabilities Coalition, advocating on behalf of more than 874,000 Kentuckians who have a disability of one kind or another. So let's talk about what happened in the session. It was a short session. We've reminded you of that, just 30 days, although I think for some of us it felt like 300 at times. So just a brief recap, there were 880 bills filed, 137 have been signed into law. 15 of those were vetoed by the governor. You may remember that they recessed for a veto period, and they had passed most of the bills at that point. 15 of them were vetoed by the governor, and all of those vetoes were overridden by the legislature. It's very easy in Kentucky to override a veto because it simply takes a simple majority of the House and Senate chambers. 14 of the bills became law without the governor's signature. I always describe that as his holding his nose and not liking the bill. And so he expresses that by not signing it, but after 10 days, it becomes law. So we just had the closing 2 days of the session. They adjourned a little bit before midnight, actually, on Thursday, and they passed another 40 bills. So he has 10 days to consider them, and if he vetoes any of them, the legislature will not have an opportunity to override the veto. I'll just remind you that we had a new senator who was sworn in mid-session, and that filled the seat of former Senator Morgan McGarvey, who is now representing the Jefferson County area in the U.S. Congress. So that's Senator Cassie Chambers Armstrong. And the final open seat, which was previously held by Senator Alvarado, and that's, let me think, Montgomery, and Fayette counties, maybe Scott, will be filled in the May 19th special election. Next, please, Alex. So I'm going to divide this into the good, the bad, and the ugly. And so the good were some of the bills that we thought were good health policy. And that's what we have here. So we have a bill on maternal mental health. It requires education to this brand new family, not only to the mom, but to the dad and other family members about what we used to call postpartum depression. We now call that perinatal mood and anxiety disorders. But the more important part probably is that the cabinet will convene a stakeholder group, and it will be consisting of health and mental health providers, training programs in mental health, because we don't have nearly enough mental health providers who are trained to address these issues, women with lived experience, advocates, and they're going to look at funding opportunities and more supports for these families. You all probably heard the big headline was that the medical cannabis bill has did reach final passage and was signed by the governor. It has very limited conditions for which it can be prescribed, and it will not be effective until January of 2025. So we expect that in the 2024 session, they will probably come back and do some tweaking, some changes of that legislation. Senate Bill 94 is an important bill because I think it will allow access to more primary care practitioners, particularly in rural areas. So it phases out a requirement for the APRNs, the advanced practice registered nurses or nurse practitioners, to have a written agreement with a physician in order to prescribe controlled substances. If they have it for 4 years and their license is in good standing, they don't have to have it anymore, which really will free them up to open their own practices. And many of them practice in the area where they were raised. So we have lots of rural APRNs out there. There was funding put in for to complete the Bowling Green Veterans Center. There was a little bit of funding. This was not a budget session, so they limited any budget discussion to just a very few items. House Bill 21 was important. It's IDs for the homeless, and particularly for homeless youth ages 16 and 17. And there was also, not in this bill, but in other legislation, some funding for the Rural Housing Trust Fund. And Adrienne Bush is going to talk more about that when she talks about the housing segment here. Some good news on unemployment benefits. You remember that last session, they were drastically cut, almost in half or more than half. And this bill did increase those benefits from 12 weeks to 16 weeks, which at least gives a little bit more leeway for people who find themselves unemployed. House Bill 148 is important for providers, particularly in mental health and substance use disorders. If you were out of network, what the insurers were doing was, instead of paying you, they would send the payment to the policyholder. And so in most cases, it never got to the provider. So this requires them to pay the out-of-network providers directly. It will be very important to agencies and providers who are providing these very necessary services. An important bill was the genetic biomarker testing to be covered by insurance. You know, one of the things that we fight about in the legislature every session, and we'll look at that in the next slide as well, are things that we think ought to be covered by insurance, and the insurance companies are very reluctant to do that. So any of these that require insurance coverage, I think, are wins for the consumers. House Bill 200 from Representative Ken Fleming is a really neat idea. It focuses on healthcare workforce, and it will provide scholarships. It allows for voluntary contributions to a scholarship fund that can be used by the person. There will be an emphasis on underserved areas, particularly in rural areas. House Bill 248 is something that we have worked on off and on for years. Representative Susan Westrom, who retired last year, brought this up regularly, and Representative Samara Heverin carried this bill to completion. There are lots of places called recovery housing, and we think that there are situations, because they're not regulated, where they really take advantage of residents. They get people that are in recovery but are homeless or have no housing, and sometimes do not treat them well. So we really feel good about this regulation coming for the protection of those residents. Also, along the substance use disorder line, House Bill 353 would allow fentanyl test strips to be widely disseminated, so people could test what they are buying on the street to know whether it has fentanyl or not. Previously, that had been classified as, quote, drug paraphernalia, so it was illegal to have it. And we know that there are people that die of accidental overdoses because they buy something, an Ativan or a Xanax or a pill on the street, and don't know that it's laced with fentanyl. So we really think that this will save lives. House Bill 551 is the sports betting bill, and we didn't take a position on that in terms of policy, particularly from a health perspective. But I wanted to point it out because there's been a group working for the last probably 15 years, maybe 20 years, to try to get some funding for education, prevention, and treatment of problem gambling. And this is the first time that they will receive any funding. They got that included in this bill on sports betting. So we really think that that's an important piece. And finally, House Joint Resolution 39 requires the Cabinet for Health and Family Services to address the benefits cliff issues. We've talked about that on previous Thrive webinars. That's where people find themselves falling off the cliff because they make a little bit too much money to continue to get whatever benefit is there. So we want to be sure that they have an easy way to transfer to some other health program or other benefit programs. So that's the good. There probably are some things that I left out, and I apologize for that. This slide of the bad or the good bills that we saw that failed to pass. And we have talked on previous webinars about the all payers claims database and what an important tool that would be for research, for consumer information, for comparison shopping, for all kinds of things, and to really know where our health care dollars are actually being spent. So there were lots of bills around this, and none of them made it across the finish line. House Bill 35 is kind of a perennial bill from Representative Josie Raymond to create universal pre-kindergarten programs for 3 and 4-year-olds. And we've talked before about the importance of those pre-kindergarten programs for kids. These next two are examples of attempts to get insurers to cover a specific set of services. One is a range of chronic pain treatments, which would also include non-medicinal treatments, acupuncture, massage therapy, and so forth. And the other is requiring insurers to cover EpiPens. There was a good piece of legislation that unfortunately did not get the attention it needed to allow victims of domestic violence to get unemployment benefits. Another one that a number of us worked on was House Bill 134. This may seem kind of in the weeds thing, but I will tell you as a provider that one of the ways that the insurers make it hard for you to provide your services is they keep asking you to justify what you're doing. So it takes many faxes back and forth or many phone calls with the insurers to demonstrate that what you're doing is a medically necessary service. So this was a bill that was a priority of the Kentucky Medical Association and for many of the provider groups. And Representative Moser got it out of one committee, but not anything after that. And I'm sure that they will be back on this because it's a very important piece. House Bill 141 was from Representative Danny Bentley, who's a pharmacist and has done a lot around insulin and diabetes care. And that's to create an emergency and continuous need insulin program. And again, this did not get any traction. House Bill 162 is a perennial entry. We're trying to protect youth from something called conversion quote therapy, which is really Senator Alsforgy Kerr used to call it conversion torture. It's where people use unacceptable means to try to convince kids that they are not gay or that what they're feeling is not right, that there's something wrong with them. And the suicide rate of kids who have been forced to go through this conversion therapy in light of what they did to try to quote protect kids and some of the anti-trans and anti-LGBTQ legislation. It really is a shame that this one never gets out of assigned to a committee. House Bill 196 passed the House but was held up over in the Senate. It came from Representative Ken Fleming. It's a program that has been used in Utah for about 5 years. It would provide a free app on the phones of all Kentucky students, particularly middle and high school, and even college students, where they could immediately text a licensed mental health professional in moments of crisis. And I suspect that this bill will come back next session. Two bills to expand child care assistance programs. And as you will hear later on, this is one of those social determinants of health that we think is so critical and is facing some real challenges going forward. House Bill 384 would have established a kind of farm to home, farm to school board to make healthy foods more accessible. It was a priority of the Kentucky Coalition for Healthy Children, but unfortunately got some traction, but not nearly enough. Senate Bill 29 is a perennial bill from Senator Meredith to limit the number of managed care organizations, or MCOs, in the Kentucky Medicaid to 3, mostly because of the administrative cost to providers to have to deal with 4, 5, 6 MCOs. Senate Bill 63 is the Crown Act. That was Senator Whitney Westerfield, would have barred discrimination on the basis of hairstyles. Some of the local communities, including Louisville, have done this as an ordinance, and the kids are so effective in trying to advocate for this. I really think that it deserves another look next time around. And then two bills, Senate Bill 67 and House Bill 129, to establish birthing centers in Kentucky. Kentucky is one of only 8 states in the nation that does not have a single birthing center. And it's because of the certificate of need regulations that the Kentucky Hospital Association is insistent that we keep in place. So that both of those bills were passed by their initial committee, and I think they will come back because there are not only providers, a lot of the midwives, of course, are very interested in this. We lose 50%, 60% of the midwives that are trained in Kentucky because they have so few opportunities to practice here. And it gives moms a real choice, including Medicaid moms. So those are the bad parts. So prepare yourself, because here comes the ugly, and the ugly was really ugly. I couldn't resist putting a red X by every one of them. So one of the first things that they did the first week of the session was to reduce the state income tax by an additional 0.5%. So that leaves a $1 billion hole in the budget going forward. I think our friends at Kentucky Center for Economic Policy, have said that overall, in terms of the health of the state, these reductions in the state income tax are probably the most damaging. House Bill 3 was quite controversial. It was touted as just juvenile justice reform, but there are many, many things wrong with this bill. It allows youth to be detained for 48 hours before ever being evaluated, which certainly increases suicide and self-harm risk. It opens the records of so-called violent offenders, which could even include burglary, for 3 years, which we think is a terribly damning policy to put in place. They're going to reopen an old building in Louisville to house them, so it's not really set up for youth. It's not set up for privacy to have mental health consultations, and there's not sufficient funding to meet the mental health needs of the kids. So we were very disappointed. There were some excellent proposals that could have been listed on the bad bills. In other words, good bills that didn't get any attention during the session, a Bill of Rights for incarcerated youth and so forth. We really need to revisit this. Another bad thing economically is that they phased out the bourbon barrel tax over the objections of all the local municipalities, who are left with tremendous holes in their budgets. So we always think when we are in Frankfort that the county judge executives and the mayors have carry so much weight with their legislators than they do on most subjects that come up, but they uniformly and unanimously objected to phasing out the bourbon barrel tax, and their pleas were left unheard by the legislators. Another bill that I think is a direct aim at the educators and at the teacher unions. It ends the automatic union dues being deducted from the paycheck, which makes it harder then for those unions to grow. Really disappointing Senate Bill 65 on kind of a technicality around the regulation that was filed by the cabinet ends a new program that started in January for adults on Medicaid to continue receiving enhanced dental, vision, and hearing benefits. We're hoping that this can get resurrected, but the legislature really just did not pay attention. They want people to go back to work, and these 3 services would have been so instrumental in getting people ready to go back to work. And then we have to end with the ugliest of all, from my perspective as a mental health provider. Senate Bill 150 has been labeled by the ACLU and a number of groups as the worst anti-trans bill in the nation. It started out as affecting what goes on in schools, and then House Bill 470, which was the anti-trans ending gender transition medical services, was thrown into it. And then just for good measure, they threw in the bathroom bill. So now the kids are required to use the bathroom that's aligned with the sex that's registered on their birth certificate. And there's language in there that is very much a don't say gay, like the Florida law. So if you can think of a single way to make it difficult for our trans kids, it would be that. And I would ask you all, if you hear about families that are moving out of the state, or providers who are no longer providing services to trans kids and their families, if you would email me, and Kelly or Alex, maybe you can put my email in the chat, please. We're trying to track this so that we know what the impact of this terrible bill is. And please email me. Thank you. Next, please, Alex. So let's stay in touch with policymakers. You know, most of us are kind of on spring break, or we're getting ready for spring, or we're just catching up on sleep. But continue to stay in touch through the LRC website. The interim session will be starting in June, and we will give you much more information about that. But follow up by thanking those legislators who voted the way you wanted them to do on critically important bills. You know, they so seldom hear from anybody except harangues or pleas for something. But if they do the right thing, email them, leave a message at their office, or drop them a note. And I've shown you here how you can email them, how you can leave a message at their office, or how you can drop them a note. And also, I would say, email the governor, and there's an easy link there to thank him for vetoing some of these bad bills, some of the ugly bills. He wrote a very strong veto message on Senate Bill 150 and on some of the others. So a little bit of thanks goes a long way. It will endear you to those legislators who you do that. And just to remind you that 2023 is an important election year. Primary in May, governor, attorney general, and so forth. The last day to register, or to check that your registration is accurate, April 17th. If you go to govoteky.com, you could check your registration or change it. We have closed primaries here in Kentucky, which means if you are an independent, you cannot vote in a primary. You can only vote in the primary if you're a Democrat or a Republican, and you can only vote in that party's primary. Also, May 16th is the special election day for Senator Alvarado's seat. And then remember that the general election is November 7th. And we don't have to be reminded that elections have consequences. And I think maybe that's it for me. Yes, I'm happy to turn it over to my pal, Dustin Pugel. Thank you.
All right. Well, I hate following Sheila because she is a force to be reckoned with, but I'm going to do my darndest, and I'm going to try and move quickly because we have a lot of updates to get through today. All right, so let's head on to the first slide there. So I like to show this chart to begin with each time, just to kind of show where we've come from and where we're going and how that stacks up against previous downturns. So, you know, despite, I think, a lot of people's concerns and valid projections, we are not in a recession right now. In fact, it's quite the opposite. Jobs are roaring. We recovered twice as many jobs that were lost during COVID compared to the Great Recession in about half the amount of time. And we're still moving forward. We're well above where we were pre-pandemic. And that is, I think, something to be proud of, and a real testament to the ways that quick action on the federal and state level with our safety net, as well as things like the direct stimulus checks and the child tax credit, really helped dig us out of a severe hole. So let's move on to the next slide. And not only have we dug out of a hole, we're actually above where we quote unquote should be had we just sort of maintained a population adjusted level of employment over that time. To put that in context, we never recovered from a population adjusted level of employment from the Great Recession. So the fact that we've already done that in Kentucky is really incredible. Now, that doesn't mean necessarily that everyone is in the workforce who could be. The Federal Reserve has done some really interesting research on this and has found that the remaining folks outside the labor force, or what could be explained by the gap in our labor force, to the extent that there is one, are folks who have retired already. And by and large, these are folks who are waiting to retire after the Great Recession, and their retirement portfolios just weren't quite to the place where they needed them, but now they've reached 70, 75 years old, and they are able to do that. The next are folks who are caregiving. This is both folks who are caring for young children, as well as folks who are caring for elderly loved ones or disabled loved ones. And of course, we know that there is a huge amount of difficulty in finding and affording childcare in the Commonwealth. And it has gotten better thanks to a lot of federal funding, but that's something that we're facing a real cliff around as well as that funding starts to dry up next year. There's been less legal immigration, primarily due to policies related to COVID-19 and then their extenuation. Folks may have also seen that there have been actions taken by the Biden administration to further restrict legal immigration, and that is having an effect on our labor force because they do make up a large portion of the folks who provide the goods and services that we all rely on. And then finally, excess deaths related to COVID-19. Sadly, we've had well over 1 million Americans die from COVID, and that is showing up in our stats in the labor force. So sort of a good news, bad news scenario where we have had a really robust, incredible recovery. And to the extent that there are folks out of the labor force, there are really easily explained reasons for that. So let's move on to the next slide. Just quickly want to say that our unemployment insurance claims are very low right now compared to where they were pre-pandemic. That is a good indication that we're not in sort of rocky economic waters yet. One of the first things that we will see if and when a downturn does hit is we'll see really high rates of layoffs, and that'll show up quickly in our unemployment insurance claims. But right now we're at less than half of where they were. Now, there was a bad bill last year related to unemployment insurance. This is something we're tracking. I don't necessarily think that we will see the effects of cutting the number of weeks that people have benefits available to them show up in the number of people who are currently using it, but there will be some other metrics. And as those start to show up, we'll start including them. So let's move on to the next slide. I want to take a little bit to really sort of zoom in on something that Sheila was saying earlier related to our income tax. We are going to talk a lot about all the ways that we help each other, or several of the ways we help each other in this state through money for housing, money for food assistance, medical assistance, mental health care, and so forth. And the way we do that is by and large through the way we raise money as a state through our general fund dollars. And the biggest chunk of that, as of last year, is our income tax. It accounts for this chart's a little bit out of date, but it accounts for about 41% of our general fund dollars. So that's about $6 billion as of last fiscal year. It's the single largest source of revenue, and it's a source of revenue that remains relatively stable even during downturns. So it's an important part of our revenue toolkit. Let's move on to the next slide. Unfortunately, we have also been at work cutting that source of revenue through a couple of bills I'm going to talk about in just a minute. But just to give you a quick snapshot of what our recent legislative actions have meant for our revenue, there's a single percentage point decrease in our income tax rate, which had been at 5%. Now it's going to be moving down to 4%, is worth $1.3 billion, which is a little under 10% of our total general fund. And remember, the entire income tax is about $6 billion. So taking 1.3 billion out of it is a really significant amount of money. There were some sales taxes on services that were introduced to make up for some of that loss, but essentially they only bring back $1 for every $18 we've lost in income taxes. So let's move to the next slide. And the problem is that this is going to compound over time. So it's not just that we have, sort of a 1-year hit to our general fund budget, and then we go back to normal. These are permanent cuts that will stack up over time to really result in a significant amount of lost revenue. The other problematic part of the way that they set up this bill which was House Bill 8 in last year, so they created 2 conditions that had to be met in order to reduce the income tax, which is their stated goal. The first is that our state savings account, called the Budget Reserve Trust Fund, sometimes called the Rainy Day Fund, has to equal 10% or more of our general fund revenue. The other, and maybe more important to what we're talking about today, though, is that general fund tax receipts, so the amount of revenue we get in our general fund, has to equal or exceed the appropriations that we make each year. So, what we pay for education, healthcare, public safety, plus the cost of a 1% reduction in the income tax rate. So that sets up an incentive not to spend more money if your goal is to turn around and cut the income tax. So there's going to be pressure on the legislators to not invest more in our healthcare, our education, and so forth, beyond what the normal pressures are. There's going to be this additional pressure to make sure that they don't remove a trigger for reducing the income tax rate, and thereby, not allow them to do something that they've been wanting to do. Oh, that's okay, Kelly. You can go on to the next slide. And to put that just 1% cut in context, this bar chart over here to the side shows roughly what it costs to go from 5% to a 4% income tax rate, compared to things like what we pay for for Medicaid, what we pay for in the K through 12 education funding. It's called the SEEK fund. It's actually more than we pay for all post-secondary education institutions in Kentucky that are public. So put UK, U of L, Eastern, Western, all the community college system, put them all in one bucket, we pay a little over $1 billion. That's less than the amount that it costs us to reduce the income tax by just 1 percentage point. Let's move on to the next slide. And while it is the folks at the bottom that this is going to hurt the most, because it's going to eventually trigger some form of budget cut, or it's going to put pressure on our budgetary needs that we have, the only people that are really benefiting from this are the wealthy. So almost 2/3 of the benefit go to earners who make $105,000 a year or more. The richest 1%, so these are folks who earn $1.4 million on average, a minimum of $500,000. They're going to get $11,000 back from this on average. The poorest million Kentuckians, people who don't pay income tax because of essentially our version of a standard deduction, they'll get nothing from this because they don't pay income tax to begin with. Let's move on to the next slide. And I think it's important to remember that other states have tried this. This is a sort of collection of editorial cartoons that I could quickly find on the internet from Kansas. Folks may remember that several years ago, then Governor Brownback took their income tax pretty well close to zero themselves, and their state government nearly collapsed. They had to go to 4-day school days. They had to start furloughing state employees. The call wait times for public benefits went through the roof because they couldn't keep people there. And our wait times are already kind of high. So these are the types of things that we have to look forward to if we keep sort of this so-called march to zero in the income tax. Let's move to the next slide. And I think it's also really important to remember, I'm not expecting everyone to read these bullets. This is more to make a rhetorical point that there are still a lot of unmet budgetary needs. So folks will remember, not only are there always pressures on our state budgeting process every time we do one of these, but we're going to add new budgetary pressures by disincentivizing new investments because they're going to want to be able to cut the income tax and meet that trigger, that second trigger. But we have a lot of outstanding needs. If we were to meet the full unmet need for the flooding victims in Eastern Kentucky, that would be about $600 million. If we were going to replace all the lost money that we're about to lose out on from the federal government to prop up our child care system, that would be $300 million. If we were going to create a state level child tax credit that could reduce poverty among children by a quarter, that would cost $712 million. You go through the list. I think one at the bottom that might be cut off just because of Zoom is eliminating the wait list for Michelle P. and SCL waivers that provide services to kids with intellectual and developmental disabilities. That would be about $144 million. So, you will hear rhetoric in Frankfurt about what our wants are versus what our needs are. But we're not even close to being able to provide for our current needs, let alone the things that would be nice to have in addition to that. So we're really concerned that cutting the income tax will prevent us from being able to invest in the things that make the Commonwealth thrive. And we really hope that over the interim, as legislators prepare for the budgeting process, they'll take a step back and really consider what we need first, and then find a way to pay for it rather than the other way around. So let's move on to the next slide. I'm going to go from doom and gloom to actually some really great news that we haven't talked much about yet, which is great because I never get to do that part. I wanted to just update some folks on some really incredible benefits that we have increased for the first time in 27 years. So through our federal TANF grant, we have something called the Kentucky Temporary Assistance Program, or KTAP, and it's essentially a basic cash assistance program for very, very poor families who have children. Often this is actually going to kids who are in out-of-home placements with family. And so these benefits go to really help support children who are in really difficult situations. Unfortunately, because KTAP is paid for through a block grant that has not changed in its dollar amount since 1995, or actually 1998, the benefit levels have also been frozen for a really long time. So, in a lot of these programs, we use either a percent of the state median income, or we use a percent of the federal poverty level, and that goes up as inflation goes up. Well, that has not been the case for KTAP. It has been a set dollar amount for both eligibility and benefits for a very, very long time. So much so that you'll see here on this chart, participation in this program has nosedived. This is only since 2016. It was even higher than this going back a little further, but we now have under 20,000 folks participating in it, including less than 4,000 adults. The benefit levels have been stuck at around $110 per person per month for a very long time now. And there's also a very quick so-called benefits cliff. So once you earn above a certain amount, you lose your benefit, and that amount is very, very low. So essentially, there is a work requirement involved with this benefit. As soon as you start earning income, you're pretty much no longer eligible for the program because almost any income brings you above that income limit. So these were very, very long overdue for updates. And so the cabinet presented 11 regulations, and I'm going to talk about a few of those here briefly. So let's go to the next slide. So just very, very rapidly here, there were several eligibility and benefit improvements. So the benefit level doubled for all household sizes, which is really incredible. That actually made up for all of the lost ground that we had from 27 years of stagnation and inflation eating into it. So we're basically back to where we were in 1995 in terms of the real purchasing power of these benefits. The income eligibility limit increased by 20%. We raised the limit for the number of assets or the value of assets that you can have and still qualify for these benefits. Those assets include things like a second family car or family land, as well as things like just money in the bank. It eliminated something that I call the two-parent penalty. Essentially, you had to be more or less a one-parent household prior to this in order to qualify for these benefits. It allows participants to keep more of the benefits as they earn income for the first year of qualifying for it. And it does several other things. It also includes several work supports. And I'm going to just move on for the sake of time, but we're going to send these slides out later so folks can see what some of the updates are. So my message today with this is, as you work with low-income families who think they might not qualify, you should encourage them to reapply because things are different now. The benefit actually has a lot of value for low-income families. Just remind folks that there is a 60-month lifetime limit for this, and that participants must complete work-related activities for all but 3 of 36 months in order to stay qualified. And I just want to say, this has been a long process of getting these regs updated. Folks from Kentucky Youth Advocates, Kentucky Equal Justice Center, and us, as well as the Cabinet for Health and Family Services, worked really hard for, again, about 4 years now to make sure that this happened. And it's a really, really good thing for Kentucky families that it did. So with that, I'm going to hand it off to our next speaker, Adrienne Bush.
All right, it's good to be with you all. Like Dustin, I'm happy to have some good news. So next slide. All right, so from our perspective, we wanted to highlight a couple of things with the legislative session. House Bill 360. This was kind of a Christmas tree bill with a lot of people's wish list, either fulfilled or not in this bill. And what ended up happening was the legislature established a rural housing trust fund, which is very similar to the statutory affordable housing trust fund that was established back in the 1990s. The Rural Housing Trust Fund will be administered by Kentucky Housing Corporation. Organizations located in rural areas will apply for funds for housing development. It creates a Rural Housing Trust Fund Advisory Committee by statute. Also, in an interesting move, it replaces the Lieutenant Governor with the Commissioner of Agriculture on the Kentucky Housing Board. Make of that what you will. All right, House Bill 448 then turns and seeds the Rural Housing Trust Fund with $10 million from and for Eastern Kentucky and $10 million from or for Western Kentucky. Basically what they did is they took the SAFE funds and they took 10 million from each fund to be allocated for that region. The first priority of activity will be disaster recovery housing, which is what we spent months and months and months talking about. All right, so the next bill that passed and has been enrolled, is waiting the governor's signature, is around IDs for people experiencing homelessness. It was filed as House Bill 21 this session. It does a couple of things, or 5 to be precise. It changes the process from a letter submission from an agency to a form to be created by the Transportation Cabinet. It allows people who had driver's license before their episode of homelessness to renew using the provider's address. This will be effective in 2025. It allows 16 and 17-year-olds to obtain a state-issued ID, and it reduces the fee from $10 to $5. And lastly, it allows homeless service providers to enter into actual billing arrangements with the Transportation Cabinet, as opposed to writing a $10 check every time one is needed. Next slide. Okay, recapping a little bit from last webinar, just remember that over the winter, the Healthy at Home Eviction Relief Fund publicly closed to new applicants. And so here's what remains of our pandemic emergency rental assistance infrastructure in Kentucky. And that is in Louisville, we have Stop My Eviction, with some limited assistance, including housing stabilization program through the neighborhood place, as well as Louisville Urban League's emergency deposit assistance program. Next slide. And then in Lexington, we have the housing stabilization program. This is expected to last the rest of this year. Next slide. All right, so as always, we maintain our contact sheet of known homeless service providers by county and area development districts. And so we have been able to include grantees of emergency rental assistance for people experiencing homelessness outside of Lexington and Louisville here. Contact us if you have any questions. Next slide. All right, and lastly, no, not lastly, but the last piece of direct assistance from the American Rescue Plan Act includes the Housing Assistance Fund for people with mortgages. The next slide covers what is eligible, who is eligible, and the amounts you can get. Next slide. Lastly, I did not want to leave this opportunity to say that since it is Fair Housing Month, April is Fair Housing Month, it's very appropriate that HUD is soliciting public comment on the affirmatively furthering fair housing rule, which I know sounds so exciting and people are just chomping at the bit to comment on it. The draft rule is it's pretty good according to our experts in the nation's capital. And I'm not going to go into detail here, but we will be drafting our comments at the last minute. If you have anything you would like us to incorporate at the Homeless and Housing Coalition of Kentucky, just let me know. Next slide and next presenter, which is Jessica Klein.
Hey y'all, Jessica Klein with Kentucky Policy. I'm going to talk a little bit about hunger and the food assistance programs in Kentucky. Next slide. So these are kind of the top feeding programs in Kentucky. There are more, but these are the ones that we're going to cover today. So first being the Supplemental Nutrition Assistance Program. Got a few key updates there. No updates today on WIC, Women, Infants, and Children Program, or the National School Lunch Program, but a few around pandemic EBT and summer EBT. So I'll be covering those. And if you have specific questions, feel free to put them in the chat or send us an email. Next slide. So the state of hunger, as you all know, 1 in 7 Kentuckians face food insecurity. That's 1 in 6 kids. And we also have the highest rate for seniors as well. So huge problem in Kentucky. Next slide. Yeah, it is shocking every time I hear it too, Marcy. But I wanted to touch base too on the SNAP participation rate in Kentucky. So SNAP is our key vital tool for addressing hunger in Kentucky. So this is the food assistance program for low income Kentuckians. Our participation rate has changed over the past few years, and you can see actually each of the points pointed to on this chart are specific policy moments in Kentucky. So you can see the dip in February 2020 being COVID-19, followed by the additional assistance and changes in benefits for people throughout that time. And then the most recent date we have is January, but I just got some new data in, so I'll be updating this soon. Next slide. So in terms of the legislative session addressing food insecurity, what we really have is a big missed opportunity, and that's House Bill 384. This was an opportunity to provide a healthy farm and food innovation fund. So what this would have done is created a structured state fund that could take on receiving and taking down additional state dollars, federal dollars, or private philanthropy funds to provide nonprofit organizations. The goal really being to leverage some funds collectively to really bring down more federal funds that often require match funding, which has been a struggle for a lot of nonprofits in Kentucky around this issue. So the fund would have a board with a variety of food system activists as part of that board, along with a variety of different, dairy, beef, different providers in there as well, farmers being represented in that board. And applicants would be required to utilize local foods. So again, stimulating local economies with that funding. So a few programs, for example, that could be matched through this fund would be, for example, Kentucky Double Dollars, which doubles SNAP or WIC at farmers markets. The Fresher X program for moms, which helps provide groceries for moms on Medicaid. And then Farms to Food Banks, which is doing that, local food connection to food banks. So that's something that we really missed out on. It went through the Agriculture Committee, and then a couple of amendments were added on. And I think, there was so much happening this session that it really slowed down this opportunity. So hopefully this is something we see in the future. Next slide. So along with that missed opportunity, I do have a few shocking updates around SNAP policy from federal perspective. This is just kind of so you have a chance to take a look at SNAP participation across the county, so you can really get a good baseline for another map I'm about to show you. But this really shows the variety of SNAP participation across Kentucky. So for example, we have 2% in Oldham County versus 43% in Owsley. So there really is a wide variety of participation, difference of about 12.3 percentage points. And this program, again, it provides discretionary money to families, but also that's money that's used in local economies, provided to local farmers and grocers. So again, stimulating local economies. Next slide. So again, the federal policy updates here, with deductions that have happened, decreases in the SNAP program that have happened with the ending of emergency allotments. People have received fewer benefits in the past few months than they have in years past. So we're really taking a look at these deductions to see if people are really getting all of the benefits that they're eligible for. Next slide. But the main policy update I want to provide to you today is about SNAP time limits. This is one of the many waived pieces of SNAP during the pandemic, and it's being newly implemented. So this hasn't been implemented for about 3 years. So this is going to be news to a lot of people on the SNAP program, but this is about to start in April. And what it is the work requirement reporting for people without children or a disability between 18 and 49. In the past, this has been called the ABOD rule because it is the specific group of SNAP participants that have to participate in this work reporting requirement. So again, this was waived statewide during the pandemic. And there still are a few, about 30 counties that are going to be waived from this requirement. But that means that the majority of Kentucky counties will have to do this reporting if they fall into this group of SNAP participants. So notices are about to go out in April. And that means kind of the first strike of this time limit, which is 3 months within 3 years, will be in June. So again, you kind of have 3 strikes and you're out, and those strikes add up across this 3-year time span. So that means that the first time somebody could have 3 months in a row where they don't report these work requirements would be October. So that's when we'll start to see disenrollments from SNAP based on this new work requirement. So when this was in effect between 2018 and 2020, about 33,000 Kentuckians lost food benefits. So it's likely with this additional reporting requirement, we will see SNAP participants lose those benefits. So we're really trying to get the word out about this policy and what the requirement really is. So there'll be a lot more communications coming out from KY policy, from Thrive, and from DCBS about this in the next few months. Next slide. So a couple of questions about when the emergency actually ends. So the public health emergency federally ends May 11th. And then there's kind of a 30-day timeline for this policy to be implemented. So that's why June would be the first month that you have kind of your strike one for this policy. So here you can see the counties where the time limit is waived, and those are the counties where it's based on unemployment rate that different counties and geographical regions is what they say can be waived from the time limit. So again, those are the ones with the highest SNAP participation. If you go back and look at that other map, you can kind of see it happens to be similar geographical areas. So again, that is still a majority of Kentucky will have to comply with this work reporting requirement. Next slide. So that's it on the time limit stuff, but I know we're going to have a lot of questions about that and a lot more information coming out soon. So happy to answer specific questions about that in the future. But basically the update with PEBT is that there is no update. DCBS has started to submit plans. So half of their plans have been submitted, half are in the works. So really, this information is coming out this summer. Again, this program makes up for missed school meals and for kids under 6 who receive SNAP. This has been provided throughout the pandemic. This program also ends with the end of the public health emergency. So this is kind of the last year that we'll be participating in this program. But luckily, we do have the summer EBT program that was made permanent. So next slide, I'll talk about that a little bit. So the summer EBT program is really focused on that summer period when kids aren't in school, and so they're not receiving the benefits that come with that in terms of food assistance. So again, that's when our childhood hunger rates really increase. So it's great that this grocery money is going to continue during the summer. So we will be applying for a 2023 version, but the new permanent version is going to start in 2024. So that'll be about $120 per child, per student who is eligible through the National School Lunch Program. So we will have more information on this. I think this is going to be more of an automatic process versus the most recent round of PBT will likely be an application of some sort. So lots of more details on this to come. Next slide, and I think this is the last one. Yes, this is another piece of the omnibus appropriation, which is affixed to a piece of fraud that we did see nationally called EBT skimming. Basically, this is a part of skimming that's it's where your EBT card can be copied, and this is happening federally. And what has really happened is we saw this in Kentucky and in other states over the past few years. And it's finally been made official that USDA has been been told that they are accountable for these funds and will have to reimburse SNAP recipients for the money that they've lost through EBT skimming. So we will see people who have lost money through EBT skimming being reimbursed for the funds that they've lost between October 2022 and September 2024. So our plan was just submitted for this to the USDA, and we will have more information on that and how that's going to look, but it will likely be, again, kind of an opt-in application type of process where you report the money that you've lost through SNAP to this EBT skimming and are reimbursed. Next slide. I think that's on to healthcare. Sorry, I had to be quick, but happy to answer questions in the chat.
Thanks, Jessica. Hi, everyone. I'm Priscilla Easterling. I'm the Outreach Coordinator for Kentucky Voices for Health. I'm also a connector. Today, we're going to talk about Medicaid renewals, which have officially restarted. It is April already. I cannot believe it. And we also have a couple of other health updates to share. Next slide, please. So as everyone else has mentioned, the federal public health emergency will expire next month on May 11th, about 5 weeks from now. So for the last 3 years since March 2020, the Medicaid renewals have been paused during the federal public health emergency. That was paused through something called the maintenance of effort provision. But back in December, the omnibus bill that was passed delinked this provision from the public health emergency and essentially set an end date for the maintenance of effort provision. That end date was March 31st. So for Kentucky, beginning April 1 on Saturday, Medicaid renewals are happening again. Now, there will be no disenrollments before May 31st, so no one should lose their coverage before then. If you hear of anyone who has lost their coverage, please reach out to us because we would want to know about it and want to make sure that no one's improperly losing their coverage through like technical issues or administrative issues or anything like that. So the most important thing to know, and we'll get into the process of exactly what's happening as in the next couple of slides, but the most important thing to know right now is that you should update your contact information and connect. That is the biggest thing. When your renewal date is coming up, DMS will reach out to people through notices and send them mail. We know a lot of people move throughout the pandemic, and so we just want to make sure that you get those notices, because if you don't get those notices, there's a chance that you could lose your coverage, and it's not because you're not eligible, just because they couldn't reach you. So make sure that you update that contact information. MCOs are also sending out letters to their members to let them know about the upcoming renewals. For people who are in this first batch of renewals, that the renewal date is May 31st. They should start receiving notices from the Department of Medicaid Services in the next couple of weeks. If you are unsure what to do or anything like that, always reach out to connectors. We are here. We are available to help walk you through this entire process and also to check your renewal dates. So here are some unwinding resources. I saw that they just dropped those in the chat. Thank you. Just drop those in the chat. The state's unwinding page also has Spanish translations of some of these communications. They are working on other languages. Our friends at KY Policy, which I just saw dropped in the chat, wrote a really great explainer about what's going on in the background and really pretty charts. If you like data, definitely check that out. And then we also, KVH, put together a one-pager that has really simple information about what you need to know, and an example of what the 3 notices look like and what to do with all of them. I missed the opportunity to add the 3 notices into this slide deck, but they're also on that one pager. So it's a really good resource. Medicaid renewal dates are available in the system right now. So you can check your renewal date by going into logging into Connect yourself. Again, reaching out to a connector to do it for you, calling the Connect hotline, or you can ask your doctor to check it at a doctor's appointment. Check KY Health Net. So those are the very basic. If you don't take anything else away from my section, definitely know this. Medicaid renewals have restarted and everyone should make sure that their notices are updated and to check their mail. It is so important. Next slide, please. So we're going to sort of skip through a couple of these things. I still included them for reference, but we don't need to talk too much about them. This is sort of that's a little bit more of the background about the public health emergency. So let's skip on to the next slide. Just a really cool point, like a cool data point that Medicaid has covered more than 400,000 Kentuckians, nearly 400,000 more Kentuckians since the beginning of the pandemic. That's fantastic. That's a lot of people who are able to have access to necessary medical treatment and care that they needed during a really uncertain time. So fantastic. Let's move on to the next slide. Next slide, 2. Okay, we'll pause here. So, and then right now, and for the next week or so, the state is automatically running the first batch of Medicaid renewals. There are around 1.7 million Kentuckians on Medicaid right now. They have all been aligned by household. So when they align it by household, there are now around 900,000 cases that have to be renewed. This is important so that everyone in the household has the same renewal date. You don't have different members who have to renew at different times. It's to help simplify things for consumers. They've also been aligned to SNAP renewal dates. So if you have SNAP on the case, then the renewal date is also aligned to that so that you do all of them at once and not have to, again, submit separate documentation or go through the process separately. So that's going to happen. The first batch of people, they are being run right now. They should receive notices in the next couple of weeks. The 900,000 cases are being spread out over 12 months. So not everyone is going to get a notice right now, but that's why it's so important to make sure you check your renewal date so that you know when it's coming up. Again, the department is going to send out those notices and let people know, but you can also be a little proactive if you have the opportunity and check that date so you know what to expect and when it's going to happen. So next slide, please. So the first couple of the caseload planning, like I said, it's spread out over 12 months. That's 900,000 cases over 12 months. I think it's actually a little bit less. They updated that. It might be around 860,000 cases now as they continue to sort by SNAP renewal dates and all of that. So the first people who are going to be prioritized are actually our Medicare eligible population. So folks who turned 65 between May and who turned 65 in the last 3 years or moving forward, their renewal dates are May through October. This also aligns with a special enrollment period that we'll talk about a little bit later. And so they're the first batch that are going to have to go through the renewal process. Beginning in June, there's a special population. It's around 14,000 beneficiaries. They will be prioritized in June. These are people who were found ineligible for Medicaid right as the public health emergency went into effect. So They should be receiving their notices beginning in May. So you should get a notice around 60 days before your actual renewal date. And then moving forward, July and ongoing will be the QHP eligible folks. So people who they don't think are eligible for Medicaid anymore, but who they think might be eligible for a marketplace plan. They will be prioritized moving forward. So like I said, 1.7 million Kentuckians who are currently enrolled in Medicaid. They think that around that most Kentuckians will be able to be passively renewed. That means that they have enough information in the system already that they're able to just check your case and say, yep, this looks right, you're good. For those folks, they'll receive something called a notice of eligibility that just says, hey, we checked your eligibility, you're good. Your next renewal date is 12 months from now. For around 236,000 Kentuckians, they don't have enough information on file. So they're going to ask for something called, or they're going to send you something called a request for information. This request for information will have a due date. It's going to ask for specific like income information, and you just have to send in that information by that due date. If you don't respond, if you don't send something in, then you could possibly lose your coverage. So it's really important to check those notices, make sure you look for the renewal date and respond by that renewal date. If you have any problems or questions or anything, reach out to a connector, we can help you, or you can also call the call center or contact DMS directly. Go to your DMS office, DCBS office specifically. And if your information has changed, if you think that any of your information has changed from what they have on file, it does not hurt to just submit that information anyway, and that'll help make sure that they're making a determination based on your current situation. Okay, so this is just a data snapshot. This is from the end of March, just a good breakdown of who those folks are. Let's keep going. This is a beautiful graph because I have a beautiful little map. I love visual displays of data. So this is a great, just to show you where those folks are expected to be. We see Western Kentucky looks like they're going to probably need to take action, more folks over in Western Kentucky than Eastern Kentucky. So just something to keep in mind. Next slide. Okay, so last month there were 3 stakeholder engagement meetings. I have linked a YouTube that they did of that meeting if you want to go back and check it out, the presentation slides, and a frequently asked questions document. This document was gathered from all of the questions from all of the participants for the stakeholder meeting, so it is pretty extensive. It is generally organized by topic, but there's a lot of good nuggets of information in there if you scroll through there as well. There are going to be ongoing stakeholder engagement meetings, and they'll be the 3rd Thursday of each month at 11 a.m. I included this, where the link is and how to join. And then if you have questions for DMS before the meetings, you can also submit those questions directly through a survey on their website that is linked here as well. Next slide, please. Okay, so just as we're talking about this, Medicaid is still always open for enrollment. I know renewals are getting started, but if you don't have coverage, if you know someone who needs coverage, you can apply for Medicaid year-round. For marketplace insurance, there is an open enrollment period. That's November 1st through January 15th for this year for 2024 coverage. But you can also get enrolled through special enrollment periods, and losing Medicaid coverage is a special enrollment period. So if you lose coverage, if any life changes happen, you can also still get coverage through there. And one quick note before I move on, so I don't forget, there is a little consumer alert that I just remembered I did not include in these slides either, but we'll make sure to link to it. We've heard some reports of consumers being contacted with offers for short-term health insurance products that are not ACA compliant. So just a reminder that there are only 4 ACA approved issuers in Kentucky. That's Ambetter by WellCare, Anthem, Blue Cross Blue Shield, CareSource, Passport, and Passport by Molina. You can always ask if you get a random call trying to offer you a plan, always you can ask for license numbers. If they don't give that to you, just hang up. If you receive a random sales call, always ask them to send a policy in the mail or through email. And they will never, if they're actually selling an ACA compliant plan, they will never ask you about pre-existing conditions or mention lifetime limits. So we'll link you to a full explainer about that, but just wanted to be aware while we were thinking about that. Next slide, please. Okay, like I said, there are some special enrollments that are available to get enrolled in marketplace coverage. If you are not applying during open enrollment, I again want to highlight losing your coverage. If you change jobs and you lose your coverage, if you had Medicaid and you're no longer deemed eligible after your renewal period, you can be eligible for marketplace coverage, and there are subsidies available that make it more affordable. So let's move on. Next slide. And then there are also exceptional special enrollment. So these are not life changes. These are not, you didn't lose your coverage because of a job change, you didn't get married or have a baby or something like that. These are like big natural disasters, domestic abuse, violence, spousal abandonment, technical issues while you're trying to enroll. Those all fall into a special enrollment, exceptional special enrollment category, and you can still get coverage throughout the year. Next slide. That's how to apply. I'm just trying to roll through. There's also low income special enrollment period for folks who have income less than 150 at or below 150% of the federal poverty line. That's again, 20,000 for a household of one or 41,000 for a household of four. You can apply any month throughout the year without having to experience a qualifying life event. Next slide. And then I also wanted to highlight, so there are new Medicare SEPs that are available. Again, I want to highlight that the losing Medicaid coverage is a special enrollment period. This is so important because if you miss your initial enrollment period for Medicare, generally you have to pay a late enrollment penalty for the rest of your life. It is a permanent penalty. These new special enrollment periods allow folks to get enrolled without having to wait for the general enrollment period, and allow you to enroll without having to pay that penalty. And so losing coverage, because losing your Medicaid coverage is one of those special enrollment periods. So they intentionally wind it up to make sure that that Medicare eligible folks who lose their coverage will be able to get enrolled throughout that SEP. So just pointing that out. Next slide. And then the last thing, I'm sure some of you may have read the news. There was a decision in Texas, Braidwood Management versus Becerra. It essentially struck down part of the preventative health services for the ACA plans, but don't worry about that right now. What the major thing to know is that nothing will change right now. Your insurer is still required to cover everything, preventative care as required right now. This decision is going to be appealed, so there's lots of time for it to play out throughout the courts, and we will of course keep you updated as we learn more. And here is an explainer on the case. So turning it over to Marcy.
Thanks. I'm Marcy Timmerman, Executive Director of Mental Health America of Kentucky. Next slide, please. I am sure most of you are thinking, yes, that Senate Bill 150 thing, it has a lot of pieces. There's got to be a lot of behavioral health concerns, and there definitely are. On the bathrooms, all I have to say is ugh. Not a lot we can do mental health wise to fix that issue, but we can expect teacher impacts. We can expect this to hurt our educators as well as our students that we know are trans and their parents. We are concerned about there's going to be an impact on peer bullying, that the provisions in this allow peers to protects them also in some ways when they are bullying a trans peer. So that's going to be a problem. We have concerns about teachers being basically able to bully trans kids because they're going to mislabel and misgender them. So the links and hyperlinks here are things on what peer bullying looks like and some strategies. There's a link on big emotions, handling fear, anger, hurt, hate, which I think all of us have been through a lot of those, whatever side you fall on this bill. But we know that silence kills. So we need to be really open about the mental health issues that are going to be around this. And you're going to be hearing a lot more from us. Please do not think that the trite words on this slide are because we don't care. It's because there's going to be a lot more coming from us in the future here. We do want to, the suicide warning signs are linked in on different places on the slide. So make sure that you know those. Make sure you're checking in on your people. You know, whatever they fall in this situation, check in on folks, right? If they're the teacher, the educator, the administrator, everyone you wouldn't think of in a lot of ways, but also, of course, our trans families and their students. Suicide warning signs, things that we want to make sure that we identify here on a prevention standpoint. Suicide by gun is probably the most common way to do that in Kentucky. And there are a few things you can do if you have a firearm that will help prevent suicide. Just to lock it up in a safe, to keep the ammo separate, and use trigger locks on it as well. And the reason we say all three of those things are probably the best practice from a suicide prevention standpoint is every single time that we have to think about another step, it gives someone, especially an impulsive teen perhaps, whose brain isn't quite developed right, gives them that moment to stop and to think and to reach out for help instead. So every kind of situation we can set up with that, the better. Same with medications. If you have those in a lockbox, if they're known to be toxic, or have them in a special location, that takes another step to get to. So just a couple of basic things that we can do in the short term. We do know that suicide is very common, unfortunately, amongst the LGBT community. And that brings me to our next slide, actually. We want to make sure that we understand that it's not because of sexual orientation or gender identity that this is the case. It is because there is a higher risk because of how they are mistreated and stigmatized in society. And so I wanted to make sure that I took that directly from the Trevor Project. So that's where it comes from. There are lots of great resources there. They are probably the most commonly referred to issue, our group that is working on this issue, and they have been stepping up in record numbers, and we really appreciate them. The Trans Lifeline is another option for information and help and assistance. They do have a specific trans folks that are trans who answer the phone lines and answer the texts. So they're another great organization for information by trans people from trans people. Their hotline does have some limited hours. Sometimes it's not 24/7, 365 all the time. So that is something to check into when you're referring folks to that line. But we want to make sure that folks can follow up on that. 988 is available 24/7, 365. Those call takers are also trained in this issue, specifically when you get to a Kentucky call center. They've had some updates on SB 150 and how that impacts some folks. So they should have some general knowledge and be open and a great resource as well. Next slide, please. One thing that is not related to SB 150 that was actually good news for us, naloxone was approved over the counter. So soon you will be able to get the nasal spray that saves people from opioid addiction, from opioid overdose, my apologies. So you actually, and for those not familiar with Narcan/naloxone, naloxone is the generic name, Narcan is the brand name. So that's why they use both words. It is an opioid reversal, basically. So someone is overdosing, you can spray this up their nose. It may take several doses if they have fentanyl. So just something to think about with that. Have multiple doses on hand if you can. And it is a short-term fix, right? It's basically the defibrillator that we would use on someone, right? They still need to go get care and they need to get help. But that is great news that it's going to be a lot more easily available. Next slide, please. I want to mention May 12th is Wear Green for Mental Health Day. So if your organization is something that can do that, we'd love for you to wear green in some way, take some photos and use our hashtag and share that Mental Health Month matters to you and your team. And the next slide. May is Mental Health Month and the National Toolkit is out. We will have our updated with Kentucky contact information stuff very shortly at the link included on the slides. We will be offering free hard copies of the toolkit. So if you have a waiting room or a need for some of those materials, that is courtesy of the Department for Behavioral Health and SAMHSA federal money that we've got for that. So thanks to them for that grant money, and we'll be happy to provide you with however many you need. We don't really have a cap on that. So I think that's it for my piece. If folks want to follow through with us, please follow through with us at our mhjky.org. Thanks, Emily.
Thank you, Marcy. And thank you to all of our speakers. I am always amazed and impressed by how much we cover in 90 minutes. And it looks like we may not go over today, which I'm also impressed by. But thank you all for sticking with us for these past 90 minutes. I hope this was informational. What you'll see in this next section, and I'm not going to cover it now, Alex, you can flip through a couple of the slides, but these are the resources that we always want to just leave you with. If you want to, find something, they should be here to kind of grab if you go to the slide deck. And this is just kind of an archive that we like to keep. So take a look at that when you have a chance. At the very end of the slide deck, we have our contact information so that you know how to reach us. And of course, if you have any questions, feel free, send us an email, and we'd love to answer those for you. But for now, we'll wrap up here, and I hope that you will join us at some point this summer or fall on our roadshow. So take a look at the agenda and the landing page that we shared earlier. And hopefully we'll see you there, and please share with your networks. Thanks so much, everybody. We'll be following up with an email tomorrow. Have a good afternoon.